welcome to the Seniors Serving Seniors, the Blue Book podcast, the place for seniors from around the Capital Regional District to learn more about the community and its members. My name is Vicki, Executive Director of Seniors Serving Seniors. Today we'll be talking about Voices in Motion, making our community dementia friendly. This is a second part of a two-part podcast. In the first one, we were joined by Dr. Deborah Sheets and Erica Fairberg. And this session, we'll be joined by Dr. Stuart MacDonald, Associate Professor of Lifespan Development and Aging at the University of Victoria. Stuart's programmatic research focuses on cognitive aging and early identification of those at risk for cognitive decline and disease, such as Alzheimer's disease.
I've been involved in studies of dementia as well as cognitive aging, the search for risk versus protective factors in relation to this transition between normal aging and memory function to so-called pathological function for several decades now. And as fate would have it, given emphasis on interdisciplinarity, I had the good fortune of working with Dr. Deborah Sheets and Dr. Andre Smith, amongst others, respectively professors of nursing and sociology. And with my background being in psychology, we each had a unique lens and unique strengths. And as fate would have it, we put in a grant for a fairly ambitious project that was going to assess a number of different approaches that people could use to make lifestyle modifications for individuals with dementia, but also for family members, for loved ones, care partners, and so on. And as it turns out, that ambitious grant wasn't funded, but we repackaged it, and we were funded by the Alzheimer's Society in particular to focus on music, on choral singing, and what we refer to as a social cognitive intervention. I think to many it seems just like it is the mere act of singing, but it's much more than that. It brings people together. You certainly exercise your lungs and even your body the way our choral conductor gets people involved and up and moving on their feet. And you definitely are exercising your mind. And that's our moral obligation when so many amazing people are giving of their valuable time to be participants in a study like this. It, of course, behooves us to maximize possibilities on their behalf. And we went into it, if I may, with a lot of research questions in mind. We wanted to understand how participation within the choir on a weekly basis could influence psychological health, of course. Would it have an impact on depressive symptoms and signs? Would it have an impact on quality of life? But we were interested in more of that, more than that as well. We were interested in the impact of participation on cognitive health. Can it change memory function, for example? And a lot of people think that because a subtype of dementia like Alzheimer's disease, because it's a progressive neuropathology and gets worse over time, that the possibilities for showing improvement in anything is very limited. And that's simply not true. It is true that as a disease like Alzheimer's progresses, that so-called plasticity of function becomes more constrained. So there are greater limitations to showing improvement, but it doesn't mean that it's impossible. And so in our case, in addition to improvements in psychological health, affect, mood, well-being, mitigating stress, these sorts of things, we wanted to look at the cognitive components. And the basic thinking there was, if we could actually ameliorate some of these other comorbidities, like increased stress, increased anxiety, increased depressive symptoms and signs that commonly go along with Alzheimer's disease, if by virtue of their participation in this movement, in this social singing movement, that we could reduce some of the numbers of those other comorbidities, maybe they could make better use of their existing neural resources, and by virtue of that, show increases in their cognitive function, for example. And so, yes, a very long-winded way of answering your question. We've looked at a number of different research questions at this point, including cognition as well as caregiver distress, and we found some very positive findings. Two that really strike me, I think, as being important pieces of information that can help provide agency to anybody who's on the dementia journey, as well as perhaps help inform public policy going forward. One has to do with caregiver distress. We all know in particular that dementia can be challenging, and we'd all be so fortunate to have the unconditional love of family members or care partners to be with us on that journey and help support us. Many do, but it does have impacts on those individuals as well, and they require some respite. The simple truth is that many of their levels of stress or distress are quite high, and so we used a commonly validated scale called the Zaret caregiver distress scale, and what we found was at the very first time of assessment, just when care partners were starting to participate in our project, that they actually had clinically high levels of distress. And that surprised us in part because it was a research study that was a convenience one, so people were invited, but if they were too busy or too overwhelmed, that, the expectation is typically you would say no. Despite the distress that these families were experiencing, they made the commitment to participate. They wanted, obviously, I think, to perhaps seek solutions or ways to assume agency themselves in terms of helping them navigate that journey. But there was a real commitment to helping others as well. And the other point being, live in Victoria tends to be high SES. Lots of support, in particular, at least for people in these studies. And yet, despite some of those advantages, these care partners were clearly distressed by current circumstances. And what we found was that across the course of that first choral season, which was approximately 3.5 months, that their clinically high levels of distress on average for that initial group reduced to clinically significant reductions, I would add, to about a clinically moderate level of distress. So still higher than you would want, but it was pretty clear that the only difference in their lives, for the most part, prior to versus following the onset, was the act of participating itself, attending with their loved one, forming community, having regular social connections, interacting with the intergenerational component. The high school students and the middle school students were absolutely amazing contributors in this. And what we also found as part of that caregiver investigation, which is a paper we currently have in preparation, that because of limited funds, always seems to be the bane of research, we couldn't run a choral season in every single month of the year. So we usually ran like January to April or May, and then there was a summer hiatus to save money, and then it would start again in September. And what we found was that although these improvements clearly happened across the 3.5 months of the choral season, after that summer hiatus, we assessed these individuals, these care partners, immediately again in September. And what we found is that their levels of distress, when the choir component was removed, were back to being almost as high as they were than when they had began participating immediately. Yeah, so it was kind of quite an interesting proof of principle demonstration that this act of being together is critically important. I mean, the singing aspect is important too, but it's no one specific variable, I would say, that is having the greatest impact. I think there's a number of influences. and part of it, and Dr. Andre Smith focuses on this given his sociological lens, but stigma from the perspective of dementia is so prevalent, and you know this well yourself. And unfortunately, one of the first natural reactions when you get this probabilistic classification that you have a dementia, that you have Alzheimer's disease, for example, is to start recoiling from extended family, from friends, from public outings. And this is the last thing we should be doing. And I think the study findings show this as well. There are many benefits to the extent that you stay involved. And I would say, despite how busy care partners were, some of the benefits came from being able to liaise with other care partners, being able to have additional sources of support, being able to incorporate additional respite into their daily schedules during the week. All of those things, I think, probably mattered there. And with regard to individuals with dementia, we looked specifically at how their mini-mental state examinations were changing across the course of each choral season. And again, with a progressive neuropathology, the expectation is that you would see continued decline, the atrophy going on, the neural cascade occurring within individual brains of individuals with Alzheimer's disease. It's not a linear process. It kind of ebbs and flows, but it is progressive by nature. And what we found is that when we looked at the rates of change for individuals largely with Alzheimer's disease in our study for this measure of global cognition, this mini-mental test, which is commonly administered, we found, yes, significant decline, but it was significantly less than what you would see for a prototypical individual with Alzheimer's disease who wasn't participating in a lifestyle intervention like social singing. So yes, the decline was still there, but the point is that it was mitigated. It was reduced quite a bit, and that led to our interest in the comorbidity hypothesis. We wanted to know, well, how do we know that it was participating in the choir that was really providing those benefits? And so what we did is we looked at change in some of those other comorbidities, and negative affect is a pretty good one. Depressive symptoms and signs and negative affect are often elevated in individuals with lived experience with Alzheimer's disease. And what we found is that over the course of the intervention, on days or testing occasions when their negative affect was reduced, their cognitive function was actually better. And that was consistent with what our initial expectation was, that if you could help reduce some of these other comorbidities, individuals might have good days as opposed to bad days because they're better able to take advantage of their neural resources. The pandemic has caused us to pivot a little bit. I think to the absolute testament and indefatigable determination of our choral conductor Erica Fairberg and the executive director Rick Berg. They've actually maintained the Voices movement, and it had been conducted via Zoom. It was virtual over the course of the entire pandemic to this point. Now, we haven't actually collected additional data during that. We've certainly been asked the question many times, well, do you think that virtual participation would still have benefits? Absolutely we do, because you're still maintaining those social contacts. But if you ask the question, do you think that the benefits would be as great as in person, where there was a rich high school component, where there was touch and laughter and communication in a way that you're more used to, as opposed to some of the artificialities of virtual communication? Yeah, I think in person would provide much greater magnitude or impact on psychological health, cognitive health, and so on. There are plans, I believe, knock on wood, should current prevalence estimates hold constant for everybody to reconnect in person come September. And absolutely, there is now actually a research arm of the Voices Project, which is now a nonprofit itself. And research will continue, and we have at least a few different ideas that we want to pursue starting in September.
I want to thank Stuart for coming on the podcast today to share his research and passion for the Voices in Motion Choir. If you would like to learn more about the Voices in Motion, please find your way to their website at https://voicesinmotionchoirs.org/. To find out more about Seniors Serving Seniors and the services we provide free of charge to all seniors in the Greater Victoria area, please visit https://sssbc.org/. That's all from us this episode. Thank you for listening.